Welcome to the Cat Clinic. Today we're going to be discussing how to set up a bag of fluids. If your kitty is experiencing kidney failure and we've recommended subcutaneous fluids at home, this will kind of go over how to set up the bag of fluids and pick a space in which you'll be administering the subcu fluids to your kitty. When you pick up a new prescription from the Cat Clinic, it will come with a bag of subcutaneous fluids. The most common kind is called LRS, or lactated ringer solution. You'll get a venoset, or sometimes called the fluid line, and this is what's going to hook up to the bag of fluids. And then you're going to get some needles. Now, we typically recommend an 18 gauge needle. It is a little bit bigger, but it will allow you to administer the subcu fluids significantly faster, which if your kitty is wiggly or not wanting to sit still for this, it will allow the process to go much quicker. Alternatively, we can go down to a pink or 20 gauge needle. It will definitely take a little longer to administer the subcu fluids, but for some people they do feel that their kitty responds better to a smaller needle size. So we're happy to help you experiment with the different needle sizes if you're interested in that. So when you take your supplies out of the bag, the first thing you're going to do is open up the venoset. This one has a little tear tab. And it will come out of the bag just slightly kind of tangled, so you'll want to take a moment just to carefully untangle the line and not cause any knots. Right now the fluid line is wide open, meaning that if we were to attach the bag of fluids to this line, the water would run directly through. So the first thing we're going to do is go ahead and clamp the line shut. There are two clamps on this particular venoset. This one, which is a rolling clamp, allows you to roll it all the way shut, and then there's a sliding clamp here. So this one slides back and forth. Personally, I prefer to use the rolling clamp, and that's the one that we use here in clinic as well. This sliding clamp can be difficult to use one-handed, so it's hard to use while you're administering fluids, especially if you're doing it by yourself. It's always advisable to pick one and be consistent and use just that clamp. Every once in a while we'll get somebody who comes in and they can't figure out why their fluids aren't working, and it's because they have two people in the household using different clamps, so they don't remember to check those. So be sure to just be consistent with whichever you choose. Now this rolling clamp, even rolling it halfway shut will stop the flow of fluid, which is fine during starting and stopping the fluids while you're administering them. However, for long-term storage, you will want to come back and make sure you shut this clamp all the way. Even just having a millimeter of space there at the bottom, especially if you're storing this vertically or hanging, you will get some leakage before you come back for your next dose of subcutaneous fluid. So make sure you shut it all the way when you put the bag away for storage purposes. The next thing we're going to do is go ahead and take this plug out of the bottom of the fluid bag. Now, don't be alarmed, this will not open the bag of fluid, so water will not come out. It's just going to open up the little port to which you will puncture to start the fluids. You'll take this cap off here. We do want to try to keep this little plastic needle portion in here as sterile as possible, so be sure not to set it on the counter or touch it with your bare hands once you remove this protective plastic cap here. So I'm going to take this off, and I am going to go directly into the bag of fluids. Now you'll see I leave everything on the counter and do this kind of horizontally. And the reason for that is it's actually a lot easier than you think if you were to set the bag like this and put it in to actually puncture through with this plastic needle tip here and cause a hole in the bag. So I do like to lay it flat here on the counter. Alternatively, once you get used to using the bag of fluids, you may prefer to do this while it's hanging. Some people that are giving an uneven amount of fluids may need to switch to a new bag of fluids halfway through the administration. So again, if you're doing that, you might have your new bag and your current bag in use hanging here, and you might be able to just swap it into a new bag. But again, that's something that you may encounter down the road. The next step is going to be to prime the line and get it ready to administer. Currently, the entire venoset or line is full of air. Now, that is not a life-threatening problem, as you may have seen on TV or in the movies. Air in a vein is definitely not a good thing. However, the sub-Q fluids that we're going to administer are going to be under the skin and not directly into a vein. So it is not life-threatening if a little air gets under the skin, but we definitely want to get rid of the whole line full of air that we have going on currently. So what we're going to do to get this started is to go ahead and squeeze this chamber. It's got a little line designation about halfway, and that's to give us an idea of how much fluid to put into the chamber. So by giving a small pinch, it will fill with fluid here. It doesn't have to be exact, just a little idea here halfway. Once you've got the chamber halfway full of fluid, the next step is to go ahead and run the fluid through the line. Now if you've got a sink or a trash can that you can go over, you can do that. You're going to take off the cap at the end, and you're going to go ahead and slowly open up the rolling clamp here, and that's going to allow the fluid to start flowing through the line. Once you get pretty steady at doing this, you can pretty much do it anywhere because you have complete control over how fast the fluid is going through. While you're new and getting used to doing it, over a sink is definitely a good idea because you may have some spillage. I've been doing this for a while, so I'm able to kind of slowly slow it down here at the end so we don't have any kind of a mess going on. All right. For now, I'm just going to go ahead and place this cap back on while we get the rest of everything set up here. So now that I've put fluid through the entire line, or primed the line, I'm going to go ahead and attach a needle for administration. Now we prefer to put a fresh needle on right before you administer the fluids, and then we like to leave the old needle on as the cap in between fluid administration. There are some people that like to have it set up and ready to go for the next administration, so they'll put on a fresh needle at the end. Personally, I do feel that bacteria may build up on the needle as it sits between administration, and I'm more than happy to have the old needle collect all that bacteria and know that I'm going to be putting on a fresh needle for the next time. You're going to want to go ahead and twist to break the seal on the fresh needle, and then we're going to go ahead and put it directly onto the line. Again, trying not to touch any of these parts onto the table or with my bare hands. I'm going to go ahead and put this on here. You'll notice that I just barely touch it onto the line, and there is a reason for that. The harder you crank that needle on, the more difficult it is going to be to get that off at the end. So definitely just putting it on very lightly, and then it's got this little locking mechanism that slides down and twists onto the needle, and that holds it in place. Again, the harder you crank that locking mechanism down, the harder it is going to be to get the needle off at the end. So definitely just very light motions for sure. Alright, so this is a very important tip to remember for the next time you're going to administer the subcutaneous fluids. When it's time to remove the entire needle and place a new needle on the line, when you untwist the locking mechanism, sometimes just from being on there so long, if you pull, only the cap will come off. The trick to getting the entire needle and the cap off is a twist and pull motion, and that will allow you to take both the needle and the cap off and have it fresh and ready to go for a new needle. So again, just be nice and gentle when you're putting this on. The harder you crank this on, the harder it's going to be for you to get it off when it's time to change it out for a fresh needle. So when you get the bag of fluids for your kitty, there will be a prescription label on the back that will designate how much and how often that you're supposed to administer the subcutaneous fluids. A new bag of fluids has 1,000 mLs or cc's in it. And so each big line, so you'll see the 1, the 2, the 3, and the 4, and so forth, those all designate 100 mLs or 100 cc's. The small lines in between the big numbers designate the 50 ml or cc marks. Most kitties are going to be getting about 100 cc's each administration. So from this beginning of the bag, we'd be going down to the 1 the first time of the administration. Some kitties will need 150 cc's, in which case you would go down to the 1.5 marker, or halfway between the 1 and the 2. So gravity is definitely going to play a significant role in how quickly you can administer these subcutaneous fluids to your kitty at home. So here in the hospital we have a pole where we can actually hang the sub-Q fluids from. At home, things that might work are putting it on a hanger and finding any surface where you can attach the hanger. I've seen some people use the little command hooks on the wall in the area in which they plan to administer the subcutaneous fluids. While you're getting used to giving these at home, it's definitely advisable to bring your kitty to an area that's comfortable for you, a countertop where you're not having to bend at an unnatural angle, where you can have everything set up just how you need it. As you become more familiar with administering the subcu fluids, it may be easier to just walk yourself and the fluids to wherever your kitty is curled up and sleeping, and to just quickly administer the fluids there. But definitely while you're getting used to how everything is working, having the setup in an area that you're comfortable with is definitely more advisable. Gravity is going to make a big difference here. So the kitty is on the countertop here. Even having the fluids up higher than this is going to definitely make the fluids go a lot faster. You can also have, if you have two people, somebody can squeeze the bag. A gentle squeeze will definitely allow the fluids to go a lot quicker. If left to its own devices with gravity alone, you're looking at about anywhere from 2 to 5 minutes to administer the subcutaneous fluids. If you have somebody who's squeezing the bag, it could be as little as 1 minute to administer the subcu fluids. So that can definitely play a significant role there. One other thing I like to mention to people, especially if you're only giving the fluids a couple times a week, where this rolling clamp rolls down to can actually pinch the line so tightly that it can actually stick together. So if you ever go to administer the subcutaneous fluids and you open your rolling clamp here and you look over and you don't see any dripping, which would signify that the fluids have started moving, it is a good idea to actually just slide this whole rolling clamp out of the way and find the area where it's been clamped together, and you can gently roll that between your fingers, and that will loosen the little plastic sides and allow the fluids to start moving again. Again, that's not so much of a problem if you're giving the fluids every single day, but especially if you're only giving it 1 or 2 times a week, you may be more likely to run into that problem, especially during the warmer months. Storage of the fluids in between administrations just depends on really what you prefer. The only thing that we will kind of tell you is to please keep it out of an overly warm spot and keep it out of direct sunlight. Other than that, it's really up to you how you want to handle it. Some people I've seen that they just leave it as a permanent fixture attached to a hook on the wall. Some people, if they have it on a hanger, will just take that hanger and move it into a coat closet or closet of any kind and keep it out of the way. Some people will take it down and put it back inside the bag in which it came in, and that is certainly fine too. Whatever really works for you. Again, just make sure it's not stored in a place that's overly warm and not in a place that gets direct sunlight, because that will degrade some of the vitamins and minerals and nutrients that are in the bag of fluids. It's important to remember that you do need to dispose of the sharps appropriately. So definitely you can order yourself a sharps container online. A lot of these actually come with a mailback system where you fill it up at home and then you just ship it back to them when the container is full. And that's definitely a good way to go. If that's not something that you're interested in doing, you do want to save the sharps safely in a container that works for you, and you do want to return those to a licensed collection facility. The state of California does not allow us to collect your sharps, so the closest facility to us here at the Cat Clinic is on Newport Boulevard at a facility called Ramsey Rexall Drugs. But you can find other facilities that are allowed to collect your sharps if you just do a search online, or we're happy to provide you with a link here at the clinic. After you've administered the subcutaneous fluids to your kitty, it is very important to carefully recap the needle in a manner that is not going to allow yourself to get poked or for anybody else in the household to get poked. So once you remove the needle from your kitty, I do recommend doing this on a flat surface, especially the first few times that you give the subcu fluids. There will be a certain adrenaline rush that you will feel, and you may be shaky. So trying to line up the needle cap with the needle in the air can, potentially cause you to accidentally poke yourself. So a good way to counteract that is to actually place both items on a countertop and to very carefully and slowly recap the needle. It is Important to know that these needles are sharp enough that you can go through the plastic and actually poke yourself through the plastic if you're not careful when you reattach the needle cap. So just be careful when you're doing that. If you are doing this by yourself and the kitty is very wiggly, you may need to carefully set everything off to the side in an area where you know that you've left it uncapped while you deal with your kitty on this area of the table until you're done working with your kitty and you're able to put your kitty back on the ground or something like that before you come back to recap. If you try to recap while there's a lot of chaos happening in the area, that will make it more likely that you accidentally poke yourself or cut yourself with the needle. So be very careful while you're putting the cap back on. Again, very slowly lining it up on the table, trying not to rush the process. Here at the cat clinic, we do recommend that you swap out the line after 3 bags or 3 months, whichever happens first. It is important to swap it out periodically and make sure that we're not causing any bacterial overgrowth in the line that might make your kitty sick in any way. However, that is a personal preference. Some people do prefer to use a new line for each bag of fluids, which is certainly fine with us. But again, we are comfortable with you reusing this line for 3 bags or 3 months, whichever happens first. I hope this video has helped to make you more comfortable being able to set up a bag of fluids to administer to your kitty at home. And if you need help administering the subcu fluids, please look for our next video, which will go over how to administer the subcu fluids to your kitty at home.